I'm Ellie Wagstaff with Elite Medical and Aesthetics, and today I'm going to talk to you about options for under-eye circles or under-eye hollowing. This is one of the most confusing topics for patients, I think, because they will say, hey, I have dark under-eye circles, and maybe look something up and think like, oh, I'm probably a candidate for under-eye filler. And this is like 50-50, I would say, whether people are candidates or not. And the reason is because there's a lot of different types of under-eye circles. Sometimes there's an under-eye circle because there's actually a protruding under-eye bag, so it's actually puffy under here. So people that feel like they're really puffy, oftentimes, depending on the reason, whether it's just that that's always how they've been, it's something genetic, it's from aging, that sometimes has to be a surgery referral. Or if people are not interested in surgery, we have to do other modalities first. So for instance, radiofrequency microneedling, or a referral for what's called Agnes RF, which is also radiofrequency. And both of those procedures essentially take needles with heat energy, kind of push the needles into the fat pad or needle, and then heat it up to shrink it. And so sometimes that can soften the fat pad a little bit to where then we can go under and do a little bit of under-eye filler for somebody that doesn't want a surgical referral. For people that do not have puffy under eyes or protruding fat pads, and it's literally just hollow here, you can see a little bit on my right eye only, it's just on one side for me, where it's just a dark circle, that somebody could be a filler candidate, but only if they have proper cheek volume. Because sometimes if people have a line from here that goes down their cheek, sometimes the issue is actually that they need more cheek volume in order to support that before under eye filler, or sometimes just by doing cheek filler it can resolve the issue. For people that don't have either, they don't have any puffiness under their eye, and they actually don't have an under eye hollow, where they just literally have darker skin under their eye, there's not a whole lot you can do. There's certain home topicals like niacinamides or hydroquinones. They can maybe provide a very modest difference. Sometimes certain laser modalities can help as well, but for the most part, it's not going to be super duper helpful. So that's why it's important to go in and talk to somebody that's really knowledgeable. Unfortunately, a lot of people will do procedures on patients that are not a candidate, and then it turns out worse. So if you have really puffy under eyes and then somebody puts a hyaluronic acid under eye filler in, it can actually make it worse because you're putting in some fillers that will attract water, so then you have puffiness, and then a filler that attracts water, and then now your whole under eye is just puffy and it looks really poor. And injectors, if I walked into a room, I would be able to tell that you had had something done. So that's not really the purpose of aesthetic procedures. I think everybody wants to have something done and then have people look at them and just be like, oh, you look so good. Like, have you been sleeping really well? That's always the goal with under eye treatments. And those are just some of the different options. And again, it's best to go to a medical professional that has a lot of experience in this so that they know when they can do something about it, or when they know that they need to do a referral, or maybe if you just don't need to do anything. This is also a really risky area to treat as well, so you want to be really careful.